Hi, I'm Dr. Schels with Advanced Chiropractic, and today I wanted to talk about the spine. So your spine is extremely important for your overall health, and let me explain why that is. So your spine is made up of bones that are called vertebra, and in between every vertebra is a little shock absorber disc pad that allows for movement. And so when we look at your spine, it should be straight when you look at it from the front or the back. And then when you look at it from the side, it should have these three beautiful curves, especially the one up in the neck area. So the way that your body works is that your brain, which sits right up here, controls all the functions in your body. Now the way that it does that is it sends energy through a hole at the base of your skull, through your spine, and then out from in between each vertebra to all of the different organs, all of the different cells and tissues of your body. And each and every organ, tissue, and cell of your body is totally dependent on the energy from the brain to keep us alive and healthy. So what can happen, however, because of different stressors in our lives, some suddenly, like in the case of a car accident, but some over the course of time, like repetitive injuries or sitting at a desk, looking at a computer all day, or texting, your kids playing video games, right? Is that the individual vertebra or curves of the spine can shift out of place. Now, when that happens, there's a fancy word called a subluxation, and that describes that misalignment of the vertebra. And the key with it is some subluxations or misaligned vertebra in the spine can cause pain, which is real common for people that come into our office to have pain. But a more important thing, even than having pain, is that misaligned vertebra in the spine can lower your overall health potential. And the reason for that is this. Let's say that when we look at the spine, remember it should be straight, but let's say that we looked at yours and there was a misalignment or a shifting of your spine in the lower part. Now, the areas where the vertebrae are misaligned, where the nerves come out, there can be a lowering of the functioning of that nerve, right? So the vertebra and the disc can literally be damaging that nerve over time. And realize the nerves connect your brain to your organs. So if there's a misalignment like this, and that nerve goes to, let's say, your colon, all right? Is there any possibility that if that's the shape of your spine, that your colon can be functioning to the best of its ability? The answer is there's no possibility. Now, do you necessarily feel that? You may feel it. You may have some back pain. You may have some sciatica. Those nerves go down into the legs as well. Or you may not even feel it, because like this type of a condition, like most health conditions, you have to lose a significant amount of the functioning and health before you have symptoms. An example of that would be like a toothache. You have a cavity, it's a hole in your tooth. It actually has to get pretty bad before it finally gets to where the nerve is exposed and you have pain. So misaligned vertebrae in the spine are very much like that. You actually have to have it for a long time in most cases to have pain with it. Okay, so at our office, what we do is when patients come to our office, the first thing we always do is we take their history. That allows them to tell us what's going on, what they've been through, and then we do a real thorough exam, and that allows the patient to know exactly how their spine and their nervous system are functioning. And then after that, we take x-rays of their whole spine from the front as well as from the side. That allows them to know exactly what the position of their spine is, if they have subluxations or if they don't. And if they do have subluxations, what we do is we give them a plan on how they can correct those challenges without drugs and without surgery, okay? So if you would like to find out if you do have subluxations or any misalignments in the spine, we'd be happy to check you for that. Just give us a call at 254-778-2225. Thanks, have a great day.